Welcome everyone. Today we have someone who's not your typical yogi, but she has done far more work to integrate everyone live a better life. She's the founder and CEO of Carer that is CARER, that is India's first integrative oncology company that provides personalized care to cancer patients. For this dream, she has been certified as a cancer exercise specialist, breast cancer recovery trainer, holistic health coach, holistic cancer coach, as well as been certified in plant-based nutrition from the world's top recognized institutes. We will discuss her work on integrative and holistic care and how it helps cancer patients, her challenges while starting Carer, prime factors responsible for cancer, and their new program called Cancer Prevention. So, we will be discussing this specific program, which basically helps people follow a protocol so that he or she doesn't get cancer in the future. So, welcome, Samara.
Thank you. Thank you for having me. It's a pleasure to be here.
Likewise, Samara. So, I'll jump right in. What was your reason to start the Carer specifically for cancer?
So my reason really, stemmed from a personal encounter with cancer. My mother was diagnosed with cancer over 15 years ago. And at that time, we didn't really know what cancer was. Actually, it's not like it's very different today, but at that time it was, it really was unheard of. And when she was diagnosed, we learned about cancer and we took her to the UK and she was treated there. But unfortunately, she relapsed. And when she relapsed is when we moved back to India and she continued her treatment here. And at that point, the doctors had told her that she has about 6 months to live and that the cancer was very aggressive. My mother went on for almost 7 years after that. And it was one of those cases that, the doctors wanted to document. They couldn't really pinpoint exactly what was, extending her lifespan, but she was taking very well to treatment. She was on continuous treatment, but the environment at home that we created, I think, played a very large part in her healing. Her entire family, we all came together and, whatever we could do and whatever we knew, we formed as a healing environment for her. So we made sure her nutrition was as good as we thought it should be. We made sure she was physically active. And most importantly, we made sure that she was in the right state of mind. So I remember the doctors used to always tell us that we don't know what's going on, but whatever you're doing at home is obviously working and the treatment is working. Now, unfortunately, after 7 years, her immunity crashed and the chemotherapy caught up. And unfortunately, she passed away actually in 2010. And since then, I went on this endeavor to find out that, what was it that we did that extended her life from 6 months to 7 years? And is there really some science behind this? And that's when I was exposed to this world of integrative oncology, which is just a medical term of using lifestyle management therapies to improve the quality of life of a patient, extend their life, improve the efficacy of treatment, build the immune system, manage side effects of treatment, so on and so forth. So what we were doing in a very unofficial way was actually being done very scientifically and medically in these renowned institutes and cancer institutes around the world. That's when I realized that, if we went through this personally as a family and didn't have access or even knew about something like this, I'm sure there are many people who are, going through the same. So that's when I decided to move back to India and start Carer, which is an integrative oncology platform, which uses lifestyle management therapies alongside medical treatment for cancer patients to improve their, their quality of life, their longevity, side effects of treatment, so on and so forth.
So, at that time, when your mother had been diagnosed, she was undergoing the traditional treatment of like the chemotherapies and the other traditional treatments which happen in the medical industry. But you all were adopting some parallel methods which helped her live a more longer life, right?
Yes. That's exactly what happened. And not only a longer life, but more of a quality life, right? A lot of people want to come into, or a lot of people get treated. And of course, everyone wants cure. But the most important thing is also quality of life. We have seen people who have extended their lives for a long period of time, but live in suffer and, and pain actually. So with her, she lived pretty normally. As normal as she could be. So it was more so even the quality of life that we improved.
So I guess when we were having that conversation regarding carer, you had mentioned that the mantra around carer is healing the body, mind, and spirit. So can you elaborate more on this?
Sure. So basically what we do, the foundation of what we do is integrative. The foundation of what we do is using food, body, and mind. If we want to change the lifestyle of a patient or even want to change our own lifestyle, you can't just change one element of it. It is not a single pronged approach. You have to look at, it's very multifaceted. So you have to look at all the elements that that contribute towards improving your lifestyle. So the foundation of carer is looking into food, body, and mind. So whatever we do when we work with a patient, we will always look into their nutritional, aspect, deficiencies, pain points, what's going on with their eating habits, along with the physical state of the person, and very importantly, along with the emotional and mental distress or state of that person.
So can you elaborate more on what do you mean by, let's say, physical or mental state?
Okay, so your physical state is your physiological state of being, right? So a lot of cancer patients have issues nutritionally, but they have a lot of physical issues. So whether that is fatigue, whether that is weakness, whether that is pain, a lot of patients, specifically breast cancer patients who go through, say, a mastectomy, who remove lymph nodes, are at risk of something called lymphedema, which is swelling of the limbs. Edema is another one. They have, extreme weight loss. So there are a lot of physical issues, postural deviations that happen. There are surgeries that take place that can cause certain disfigurements in the body. So that's what we term as physical, anything physiological that is happening to the body. And the mental or the psychology part of it is obviously working with the mind, working with the emotions. How is the patient feeling? What state of mind is the patient in? Are they in a state of, fear, stress, anxiety, depression, helplessness? So these are the little things that we look at, and then we help them move forward and basically create a more I don't like to use the word positive because I think it's overused in cancer, but create a more positive state of mind for the patient, or encouraging state of mind to help them and motivate them to move forward and heal.
So are there any specific tools being used to help them get to that level of state?
It really depends on patient to patient. So basically with our yoga therapy, it's very much a mind-body practice. It is obviously an inculcation of asana, pranayam, and meditation. But the type of yoga that we do is, we basically encourage the patient to go into a very, very relaxed state of mind. We use certain techniques of meditation, whether it's guided meditation or visualizations, or a quick release anxiety meditation, or whatever that might be, to help stimulate the parasympathetic nervous system and help the patient really go into just a calm state of mind. Now that's through the yoga, but through the mental well-being that we offer, this is very much talk therapy. So we've noticed that a lot of patients want to talk about their feelings, or they don't have a platform to talk about their feelings. Many of them feel like they have been or are a burden to their family members, and they actually are able to open and express much more with a mental well-being therapist that they're not that familiar with than their own family members. We have seen this time and again. Some of our sessions in the mental well-being sessions is literally our therapist walking in and saying a couple of words and having the patient speak for 2 hours straight. And that has been therapeutic for them. So we use a lot of talk therapy there. We give them a lot of activities, whether that is encouraging them to do some art or some, using sound therapy and things like that. So these are certain techniques which is prescribed to the patient based on their condition. So that's how we go about it.
During our last conversation, you had spoken about a new program which you all have started recently called cancer prevention. So what does it comprise of?
So, so the reason that, for the longest time we've been asked, I mean, obviously a lot of patients come to us and their family members say, if you've built such a comprehensive program for cancer patients, do you have anything for cancer prevention? Because we are very, very worried that we are going to get cancer. For the longest time, we didn't do it because for us, we believe that if you're doing one thing, do it really high skilled, high quality, and get it right, so we're working with people's lives. So we said that's not really, we don't have the bandwidth to get into that right now. But in the last 1 year, we've been working on a cancer prevention program. We realized that we were using lifestyle therapies to treat cancer patients and help them recover. We also realized that, large percentage of cancer cases, 90 to 95% of cancer cases is lifestyle related, which means that if it is lifestyle related, then there are certain things that we can teach a person to do to improve their lifestyle and actually decrease the chances of cancer. And that's exactly what we started building. So we started building this very in-depth cancer risk assessment. It's a lifestyle cancer risk assessment where we run a risk assessment with anybody. And we try to understand if they fall under the low, moderate to high or high risk category. And then we tell them exactly what they can do using their lifestyle to bring their risk lower. So till we refine this, we didn't want to introduce this program, but now we have refined it and we have actually launched it, and there are tons of people who are taking this program. And we work with pre-existing conditions. So whether it is chronic obesity, COPD, type 2 diabetes, hormonal imbalances, gut issues, there are certain major pre-existing medical conditions that can lead to cancer, certain types of cancer. So we're working a lot with those conditions. We're working a lot with a younger population where they're like, okay, we are worried about our risk of getting cancer. So they try to understand where they fall on that score or that scale. And then we understand their lifestyle habits, looking at food, body, and mind. And then we tell them exactly what they can do. We put them through a program, and it is a minimum of 1 month, but that's for people who are in low risk category. And we tell them how to eat better, what to eat, where to get the food from, what kind of exercises they should be doing, how do they manage their stress levels. Again, very integrative, but again, focusing on the prevention of cancer. Now, obviously, this is not something where we can guarantee that you will not get cancer, but this is the best that we can do to keep your risks low. So we then assess the person again after a month and see where they fall in the category. And then we keep going on till they fall into, minimal low risk category.
So since you have started care and the recent starting of cancer prevention, do you all or have you all got any prime factors which you feel are responsible for cancer? Let's say any 2 factors or 3 factors.
I would name about 4, which I'm seeing a lot of. Number 1 is high fat levels. This is causing a lot of disruptions with hormones and leading to things like ERP positive breast cancers and HER2 positive breast cancer. So high fat percentage is something that's leading to certain types of cancers. I would say, chronic stress. This is something that people don't take very seriously, but I see it time and again. In fact, my own mother, I feel her susceptibility to cancer was her stress levels. What stress is doing to the body is just, it's really, really bad. Basically, and I say chronic because it is releasing cortisol in the body. It is causing inflammation. It is causing disruption in the gut, and it's leading to complete chaos in the body to function properly, which is eventually suppressing immunity, and that's leading to certain types of cancer. So I would say chronic stress. We are seeing links from type 2 diabetes to certain types of cancers. We are seeing links of COPD, which is chronic obstructive pulmonary disease, that is leading to certain lung cancers. So these are the main ones that I would point out and say that, you know, we need to keep an eye of. So anything with severe hormonal imbalances, thyroid issues, people with very extreme significant gut issues. I keep talking about gut. If anyone were to go to my Instagram profile or whatever, or carers, you'll see so much about gut health. The reason we speak so much about gut health is because 60 or 70% of our immunity lies in our gut lining. Now, I believe everything happens in the gut. That's where you basically, you know, that's where you absorb nutrients. That's where you assimilate nutrients. That's where you excrete waste. That's where basically you will determine whether you have nutrient deficiencies or not. So the better you eat, the better your gut lining is. The easier it is for nutrition to go to different parts of the body and function appropriately and go to different organs. So if you have, you know, a bad digestive system or problems with gut health, that should be your number one thing that you need to focus on. I see a lot of people who are chronically constipated, or they have IBS or leaky gut and things like that, and are living with it for years and years. And they don't realize that by living like this for years and years, it's affecting their immunity to a large extent. So if you want to fix your immune system, if you want to be resistant to a cold or cancer, fix your gut. So that's what I focus on.
Yeah, I'm not sure whether what I'm going to say would be correct or no, but the recent death of Chadwick Boseman was diagnosed with, I guess, colon cancer, and it was very surprising to hear that this he was not that old. He was in a very fit condition, but I'm not sure whether lifestyle had it on him or what was the prime reason. And yes, again, the point which you just said about gut, these are issues which are not evident enough to be made out. Let's say if any friends are meeting, you can't make out that your friend might have a gut issue. But okay, if your friend might be smoking, that's very clear that you could be diagnosed with cancer.
So it's interesting you're bringing this up, because we have this conversation a lot in my team. And in fact, a lot of people reach out to me and they say, well, my father has been smoking for the last 50 years and he's perfect fine. My grandfather has been doing this. My grandmother has been eating like this. They are perfectly fine. So why should I make that change? So we need to understand the times and the environment that our fathers and our grandfathers and great-grandfathers and ancestors grew up in. I'm sitting in New Delhi right now with an air quality of above 300, 400, which is going to go up to about 500 and probably plus that. That's something I can't control. I'm pretty sure my father and my grandfather didn't have exposure to that kind of environment when they were growing up. So that's why we always say it's an integration of everything. It's not just, your immunity doesn't lie only with the air that you're breathing or the food that you're eating or your exercise level. It is all of it. How do we see so many marathon runners or people who are really fit have heart attacks? I mean, that just doesn't make sense.
You're right.
So that's when I started talking a lot about visceral fat. Where is the fat lying in the body? Physically, you might look really fit, but are you stressing your heart out to that degree? Over exercising, which creates inflammation, which creates free radicals in the body, which over exercises the adrenaline glands, which really doesn't work for our bodies right now. And visceral fat is the one that you need to be careful of, because the visceral fat is the one that is lining the organs and is around the organs. So you might look really thin or you might look really fit, but if you have high levels of visceral fat, then you can be as fit as you want, but that's the dangerous part. Now, with colon cancer, it's very much related to the kind of food you've been eating. Now, I can't say that's the exact reason, but a lot of people who have been consuming a lot of red meat for a long period of time, or consuming foods that are toxic for them, have had gut issues, are causing toxicity in the gut lining, and which can lead to polyps, and then can also lead to polyps that become malignant and actually lead to colon cancer and rectum cancer and things like that. Colon cancer is also genetic. So that's something that we need to look at. And people who have a history of colon cancer need to do their tests and things like that. But most of the time, it's very related to the kind of food you're eating and gut health.
I had this recent conversation with a yogi, is very experienced yogi, and he mentioned a point that cancer doesn't reach places where there's a lot of blood flow, whereas it affects easily where there's the blood hardly reaches there. So how true is this part?
See, everyone has their own points of view. I don't want to comment on what he said, but what actually happens is cancer creates a home or an environment for itself. So basically, our cells are multiplying and dividing. As we speak, trillions and trillions are multiplying and dividing. Now, in this process, there could be certain rogue cells. There could be certain default cells. And what happens is our immunity kind of like, surveys these cells and says, okay, these cells are not good cells, let's destroy it, and destroys it immediately. Now, what happens in the sense of cancer is that our immunity is not able to pick up on these rogue cells, and they let them grow and divide and multiply, and eventually it becomes a cluster of cells. Now, this cluster of cells is known as a tumor. Now, when this becomes a cluster of cells, it creates a home for itself, and it starts creating its own blood vessels, and it starts creating food for itself. And it really, it's called the process of angiogenesis. So that's when basically it becomes difficult to actually eradicate that tumor, because it's created a home in and an environment in your body. And basically chemotherapy goes and disrupts that. So what happens, it starts mimicking the actual cells. So your immune system is not able to pick up, okay, that this is a bad like cluster of malignant cells, and this is good benign cells or healthy cells. Basically,
It can't differentiate between the two.
The more it grows, it can't differentiate. So now that's why chemotherapy, unfortunately, has to destroy all the cells, the bad and good cells. And that's why the side effects of chemotherapy is so vast, because it's destroying your good cells as well. It's not able to differentiate and say, okay, fine, this is the cancer cells and these are the good cells. But as we progress in medical treatment, we are doing more targeted chemotherapy, where we are able to identify that these are the malignant cells and these are the good cells. So don't touch the good cells, focus on and target the malignant cells. So that's basically on a very, very surface level what's happening with cancer.
It's funny. Means the conversation on cancer has been like so common. I heard this on a podcast that there's been a lot of talk in the States that people are not asking that whether you'll get cancer. It's like, when will you get cancer? So it's like a very common fact there that it will happen. When will it happen is the question.
Yeah, I think in the States it's about 1 in 3 people who will get cancer.
Wow.
If I'm not mistaken, that's the number. And I think in India, again, if I'm, I could be wrong, but it is about 1 in 8 people as of right now.
Wow. So that is yet a high number.
Yeah, exactly.
So, Samara, as per your research, which is like the one activity from the integrative holistic care that makes the most benefit for any patient?
So I can't pick one, because it really depends on each patient, right? So like each patient comes with certain issues. Like I have worked with patients who are extremely nutritionally diligent and fit, and physically fit as well, but mentally they are in a very bad state of mind, and that's affecting their recovery. So then for them, mental well-being is the most important element of it. And it goes on, like, so if you work with a head and neck cancer patient, these are cancers in the head and neck region. It could be like tongue cancer, thyroid, whatever, anything in the head and neck region. Most of these patients will go through surgery where they will have to have a feeding tube, where they'll have to start having, liquid diets. Now, in that sense, obviously they drop tons of weight. There are a lot of nutritional deficiencies. So for them, nutrition plays a very important role. So it really depends on each person. That's why we never say it's just one. That's why we always, through Carer, offer food, body, mind. It cannot just be one. But if you're going to ask me if I really need to pick one, it's really difficult, but I would always say food is medicine. Food will change the way you live.
Food will make a big impact. And I guess many people have made medicines their food.
Yeah, exactly. I think everybody. Yeah.
So, Samara, now coming to you, how do you prime yourself for the day? Like, do you follow any morning routines?
So I do as much as I can. I have I wouldn't say I'm extremely spiritual, but I do a lot of, or I try to do as much of chanting as I can. I'm really into the Buddhist chant, and that's something that I've inculcated in my life. So I do that in the morning while I get ready for the day. I ideally like to do some form of exercise in the morning, but unfortunately in Delhi right now, the pollution levels are so high in the morning, so I'm trying to do it a little later in the evening. I used to do extreme kinds of workouts where I used to sprint. I used to do, obviously your HIIT training, your, every kind of major exercise routine I have followed. And I have recently just started going for like long brisk walks to give my body a break. And it has been one of the most wonderful things I've done, even for my mental state of mind, actually. And that's about it. And, I call it a day at the end of the day. Yeah. Early, actually.
So, let's say if you have any situation where you have just a 10 or 20-minute break, do you fit in any specific exercise routine, or is it just walks which you try to make as of now?
What I learned with my many years with my own personal experience of really being into sports. So I used to be very heavily into sports, and then I went crazy with being one of those just extreme people when it came to working out. I would work out 3-4 hours a day, maybe not 4 hours, but at least 2 to 3 hours a day. Just really putting my body through extremes, running marathons, sprinting. For me, it was just one of those things. I don't know. I really got very deep into it. And then I studied it, right? I went to the US and I actually studied, physiology and training and the anatomy and exercise and, personal training and whatever. And that's when and functional training. And then through the years of working with so many people through physical movement and also through my own experience, I realized that working out 1 hour a day, extensively, doesn't do that much benefit for you, as opposed to working out small, segments in the day for the whole day. So it might become difficult for someone to get up every 2 hours and do a 10-minute sprint, right? We sit in office or we're working the whole day or whatever. So what I do is I walk and talk, and I tell all my patients and everyone who are unable to give too much time to exercise, I say, you know what? There's no excuse. Walk and talk. We're on the phone, especially now, constantly, because sitting at home and we're working. Every time I pick up the phone, I walk. It's just become psychological now. And honestly, before I know what I've done, I don't know how many steps. So I'm walking and talking. I never take an elevator or a lift anywhere.
Wow.
Unless we're talking about like 12 floors or 15 floors, and I really, and even then I would push myself to take the steps, and especially, and if we are really high up, maybe I will take a lift up, but I will definitely walk down,
Mm.
So these are all little habits that you create in your mindset that you eventually will just automatically go to the steps. It doesn't even register. You'll eventually, a phone rings and you'll just eventually get up. Like I've sat in meetings and phones have, and I've had to excuse myself, and I've automatically just gotten up and started walking in the meeting room, because it just becomes habit. You are doing more exercise and you're doing more benefit for your body just having these little bouts of movement than going for an hour and putting your body through extreme workouts and lifting weights and doing these circuit trainings or whatever, and then sitting the rest of the day. It's probably the worst thing that you can do.
I had read something about this topic on blue zones, where there are like 5 places around the world. For people who don't know about blue zones, these are like 5 places where people have an average age of more than 100. Correct me if I'm wrong. So I guess if we just follow their lifestyles, we are good to go. But given that most of us are like shifting to cities, it is getting tough and tough day by day.
So like you're talking about the blue zones. I read the book as well. I think Okinawa, a place like that in Japan, is one of the areas. They definitely don't do HIIT training and circuit training, and they don't have access to all of that. They get up and walk. They get up and pick things. They get up and do chores in the house. I mean, I think doing house chores, and I learned that after lockdown, is actually a great exercise. You know, you need to clean the house. Do that. You know. So I understand if you want to do certain amounts and challenge your body. So once in a while, definitely lifting weights and pushing your heart rate to that extent and doing interval, interval kind of training and those kind of things. It's good for your body to put your body in a little bit of shock is fine. But if that becomes a way of life, then I don't know. I don't know the long-term effects of that. It's quite.
So, Samara, we've just come to the end of the show. What message would you like to share with everyone?
So I would ideally say two things. Number one is that I think when it comes to cancer, a lot of people fear the word cancer. They fear it because they don't know what cancer is all about. There's a lack of knowledge. And this is where people need to educate themselves about exactly what cancer is. So instead of fearing this disease, I would encourage people to go and actually learn about it and gain the knowledge that they can in order to actually protect themselves and learn that actually it's not that scary after all. It's becoming a chronic disease, and it's very much lifestyle related, which means that it's in their control. So when it comes to cancer, knowledge is power. And the second message I would like to say is that that you have the power to heal yourself. I keep saying this. When we are diagnosed with cancer, we give all that power to our doctors, our oncologists. We give up the power of our bodies actually, but we heal ourselves. Even with Kero, we always tell our patients that we are just the conduits to their healing, but they are actually healing. So we all have the power to heal ourselves, whether we have cancer, whether we have any chronic condition, whether we are perfectly healthy, our bodies heal for ourselves. And this is something that translates with each one of us. So before giving up that power to anyone else, realize that that power first lies within you.
Yes, I guess we can consider those as golden words. We do have the power to heal ourselves. And I hope everyone should definitely look into their own lifestyle to follow those parameters. Yes, Samara. Thank you for coming on the show. Where can everyone find you on the internet?
So they can find me on my Instagram handle. I put a lot of great content out there. It's Samara Mahindra 1, numerical 1. They can find Carer, which is it's actually carerforcancer.com. That's CARERFOR cancer.com. They can write to us, which is hello@carerforcancer.com. And they can even call us at 9900016441.
Great. I'll definitely do make sure to include all those links and social media handles in the show notes. Thank you, Samara, for guesting us. Thank you.
Thank you so much.